An automated system that helps perform contact tracing in a private, anonymous way has the potential to reduce disease spread during a pandemic. Our goal in these data collections was to gather Bluetooth measurements using an exposure notification app and assess how sensitive and how accurate the Bluetooth-based exposure risk estimate is under different conditions. This video shows one of the more complex test scenarios, imitating a party with 14 participating phones. This work was done before we had COVID vaccines, which is why only 3 humans are at the party, and the rest of the guests are robots that absorb radio signals about the same as a human body does. The motion capture system in this facility provided accurate ground truth distance and orientation data for all the guests and phones. Let's pretend that the robot in the green hat, number 16, has COVID-19 and doesn't know it. How well will the other people's phones detect their risky exposures? Each phone has a dose meter floating over it with both a low threshold and a high threshold for alerting. If the dose stays in the green zone, the user wouldn't see an alert later. If it crosses into the yellow zone, they would see a medium risk alert, and if it reaches the red zone, they would see a high risk alert. Most of the phones in this test were Androids, which were a little easier to work with. The iPhones didn't give us the minute-by-minute data needed to show the accumulated exposure over time, so for this video, they don't have meters. At this point in the party, Robot 12 has been too close for too long to the sick robot and would receive a high alert a few hours after the sick robot shares its positive COVID-19 status through the app. The close contacts of the index case, that is, number 16, would also receive guidance from their local public health authority on quarantine and getting tested themselves, so that they don't accidentally spread the disease to others. You might notice that Robot 6 isn't recording any exposure right now, even though it's too close to the index case. As it turns out, in this scenario run, neither number 6 nor number 8 recorded any exposure messages from number 16. This could be due to radio signal absorption, interference from other radio signals, or poor calibration of the transmit power by the manufacturer of phone number 6. Exposure notifications aren't perfect, but the system has been shown to extend the capabilities of public health contact tracing teams, and it acts as a sentinel to help people be aware of their own exposure risk. This helped to save lives in combination with other non-pharmaceutical interventions, such as mask wearing and increased ventilation. As the party winds down, we see that most of the guests would be receiving high-risk alerts later on. If number 16 were to develop symptoms, we would hope that they would inform the other guests directly, but they may not have a way to contact everyone. They may feel too sick to take care of it themselves, or they may have personal reasons for wanting to stay anonymous. Exposure notifications helps to close the gap between known and unknown contacts, and to reduce the time it takes to notify others. The data collected from this project was shared with public health teams across the United States and internationally, and it has helped public health authorities to decide which exposure notification settings to use in their regions. To access any of the PACT datasets, you can visit http://pact.mit.edu or search GitHub for MITLL and PACT.